Yes. Hello, everybody. My name is Lucce Sona. I'm from Paris. I live in France. Uh, I'm gonna tell you my story, my journey with sickle cell disease, and my recovery by bone marrow transplant as an adult. For me, my story began pretty well. A smooth birth, at least for me. I was a beautiful baby and calm, playful, anything you would expect from a normal child. Suddenly, I don't sleep at night anymore. I cry all the time. It's impossible to calm me down. They are my first crisis. The diagnostic come out very fast. The doctor had a very bad news for me and my family. They are giving me only 3 years to live, but they didn't know me well. I was stubborn. I was a warrior. I was determined to beat this odds. Of course, it was painful, rich, 5 years old. So, so my parents did fight as well because they managed to bring me in Europe to get a transplant, my best chance to survive. Unfortunately, things were stacked against me, and no one of my siblings was 100% compatible for transplant. On top of it, I can't go back home anymore. I am too sick to travel, and I have no other choice than staying in France. I thought the worst I could live was the crisis on cold and cold weather, but I didn't know yet that SCD is an evolutive disease and that I will have to face terrible complications. An extremely painful crisis, a stroke that left me paralyzed on my left side. I look like Two-Face for weeks. I don't even talk about the gallbladder surgery and the chest syndrome. I've been given all sorts of treatments, hydroxyurea from 9 and transfusion following the strokes at 12 years old. I, I received blood for 19 years. Every 4 weeks, sometimes more, I was a real vampire. So uh, you can't live with this disease. You barely survive. It's a perpetual race for survival and on all psychological and physical, social, emotional fronts. It's unbearable. SCD handicap you in everything you do. Study, work, relationship. It's hard to wake up in the middle of the night with a nutritious pain impact all your life as well as the life of your close one. The turning point in my story was the birth of my daughter. The crisis doubled in intensity and numbers. My arteries were damaged. Morphine no longer has an effect on me. I have to use ketamine. I had six implantable venous access devices with which all led to major septicemia. I was hitting rock bottom. I felt like there was no tomorrow anymore. I thought my next crisis will be the last. Fortunately, medicine was progressing hugely. I was about to lose hope when a miracle happened. I found the transplant trial in UK, and I did everything to be the first patient in Europe to experiment this new technique to heal. Back then, there was only a survival rate of 50%, and you know what? I survived. The transplant went well. I was anxious because even if I was familiar with being at the hospital, I didn't know chemotherapy, raise, and sterile room. not being able to take a real shower, food restriction are really nothing compared to GVHD and chemo secondary effect. I was expecting hair loss, but it's still a shock. When they told me I was cured, it seemed so surreal to me. And anyway, I still have a long way to go. Surprisingly, it was not the end of my trouble yet. I used to think that healing physically would be the end of my pain, but then I realized that I have to rebuild myself from the inside. I didn't know who I was anymore. I didn't know how to create a normal life. The basic things I didn't know. The SCD put me in survival bubble, and when the bubble bursted, I was lost. The aftermath of transplant was also a thrill. My whole body resetted. I have to redo all my vaccination, continue the anti-reject drugs. I have never felt so fragile and vulnerable than during the 3 first years. I was exhausted and lost, but step by step, by looking for and meeting the right people, I got off of it. Now, with my experience and expertise, I had created a sickle cell pain training to understand the specific functioning and the avoidance strategies with visual and sound tools. I managed to perceive painful crises and make a link with the no pain. I also accompanied transplant patients with a coaching and mentoring program. But my goal this year is to make my therapy education book for sick and disabled children. Uh, in conclusion, the bone marrow transplant saved my life. I'm convinced that transplants have a decisive role to play in this fight against SCD. Thank you. Sorry.